Hi, welcome to Project Elivate, where we will discuss all things related to health, hormones, aesthetics, and longevity. The topics discussed are the opinions of Olivia Savers, nurse practitioner. They are not intended to diagnose or to treat any conditions. If you have any questions regarding your personal health, please talk to your personal healthcare provider or see us at Elivate Wellness. Now let's get to the show. This is episode number 17. And we are going to be talking about the thyroid. So we're going to do this in a series. And I think what we're going to do today is just talk about the thyroid, what it does, why it's important. Everybody's heard of Hashimoto's thyroiditis or Hashimoto's or Hashis or, different terms. We're going to talk about that a little, but I think we're going to save that whole topic for a whole nother podcast. So for those of you listening that have it, it's coming. Okay.
Yeah.
But
we're just going to talk about what the thyroid does and its purpose and its job, I guess is the best way to say that. And I always start by telling people, and it's just a generic way of saying it. I think people always talk about like your heart, like your heart is your life. And I was telling her earlier, I was like, I tell my patients, if your heart is your life, your thyroid is your soul. Mm-hmm. Because yes, you have to have your heart to pump your blood or else you're not going to be here. However, your thyroid controls everything else, like from your metabolism to your bowels, to your energy, to your mood, to your hormone production, to your gut. The end product of the thyroid, his job is to go out to every cell in your body and communicate a task. So, yes, I love my heart. I need him to work, but I need my thyroid to work harder.
Well, and the thyroid will impact how well the heart works.
Yes, very much so. It is the signaling system. Like without your what is the power unit in your house? Your breaker?
Yeah.
Without your breaker, your lights won't turn on. So that's why I tell people it's so important. So
the thyroid. Let's talk about what it is, because Marissa, I didn't realize this, but Marissa brought it to my attention a couple weeks ago that there are many people that think that men don't have thyroid.
Oh, yes.
And men and women, everybody on earth, unless you've had it removed, okay? Or some people, I guess, could have been born without one. I mean, there are instances, but the thyroid is all the way across men and women. We have it.
I think my men just think they hear their wives talk about their thyroid and their hormones. So therefore, they think it has to do with something feminine related. However, it does impact your hormone production as well. We all have hormones. So I think that's it. Interesting that they just, I don't know why it's not expressed so much in men. Like, why is that not? It's more common to have disruption for the thyroid in women, but it still affects men.
Oh, yeah. We have plenty of men that have hypothyroidism.
Yeah.
So the thyroid is a gland. It's a butterfly-shaped gland, and it sits at the base of our neck. Okay. There's this little communicator called the thyroid stimulating hormone that comes from the pituitary gland up here in your brain.
We should have brought a picture up here.
I know. Yeah. So if you want to see this illustrated, go back and watch the other podcast where
we showed it what it looked like a little bit. My rough doodles.
Yeah. So yeah, this thyroid stimulating hormone, it comes from the pituitary gland, talks to the thyroid and says, hey, make thyroid hormone. The thyroid, when it's working properly, is like, okay, sure, mom. I call the brain the mom. The thyroid's the kid and needs to clean up its room. Okay. So mom's saying, hey, clean up your room. The thyroid obeys and starts making thyroid hormone. There are actually 4. There's T1, T2, T3, and T4. But we're going to focus on T4 and T3 because that's typically what we test for when we replace thyroid hormone. That's what we use. So it makes a lot more T4 than it does T3. It makes a little bit, but our body's job is actually to convert T4 into T3. And T3 is the active thyroid hormone. As Marissa said, thyroid affects every cell in our body. Every single cell in our body has a T3 receptor on it. Everything. When I say receptor, if you're looking at a cell, and I know some of you are listening to this, but let's pretend like my hand, the palm of my hand is a cell. My fingers are the receptor sites. They're like little docking stations. T3 needs to attach to those docking stations and deliver its message because hormones are chemical messengers.
Yes.
Okay. So that's how, and so when that T3 attaches, it tells the cell, hey,
do whatever job you're supposed to be doing.
Yeah. Ramp up metabolism. Let's get some energy going. Let's utilize the nutrients that you have in there, blah, blah, blah. So let's talk about the types of hypothyroidism. Okay. So your thyroid can be hypo or hyper. Let me just go ahead and say that. Hyperthyroidism is called Graves' disease, and that's an autoimmune condition. We're going to put that on the back burner for just a minute because we'll probably tie that into the Hashimoto's conversation we have later. Hypothyroidism is 90% of the time caused from Hashimoto's, which is an immune condition. It's not a condition of the thyroid. It's an immune condition. But again, we're going to push that over to the side for just a second.
Okay.
Oh gosh, I keep bringing it back, don't I? Okay, so when we're talking about the thyroid gland itself, issues could be, does it not make enough thyroid hormone, period?
Yes.
Okay. Is there something going on up here that's not communicating well with the thyroid to say, hey, make more? Okay, so is that communication going wrong? Is the thyroid gland itself defective? Or are we having something going on at the cellular level where the cells are rigid, the walls are hard? That's called that metaflammation or inflammaging we were talking about, where it's not really willing or able to accept the thyroid hormone.
Yeah.
Or do you have a conversion issue? We talked about the T4 to T3.
Yeah. So just to recap, you can have how your thyroid works is normally he has a steady stream of hormones he produces. There are things that can go wrong. He can work too hard. Okay. He's spitting out too much information too fast. He's working the hardest day of his life all the time. Okay. Or he could be not working enough. And then those are subdivided into if we're not working enough, like if we're not producing enough of that output of that energy, it's either we don't have a good hospitable environment. She's talking about the cellular walls, like you're not at a cellular level able to absorb those end results. Our thyroid is under attack and we have an autoimmune issue that's causing damage, or we have the messaging system that tells my thyroid to do its job. There's not an appropriate messaging system, or did I cover
the conversion?
Or the conversion, or that T4 that's turning into T3. It just does not happen appropriately. The goal is T3. We need T4. The goal is T3.
So that's what we see oftentimes is that I would say most people are poor converters of T4 into T3. So I want to talk about some things that will impact that. And the thing that I think I see the most is under eating in women, even actually sometimes in men too. So when you are under eating, your body, it's almost like trying to run your car on fumes.
An empty tank.
Yeah. So your car's like, I'm not going to do this. I'm going to start spitting and sputtering and acting crazy. Your body's the same way. It's going to say, we don't need to metabolize anything, or we don't need to increase our energy. We're running on very little energy here. We need to pump the brakes.
Farting on fumes, boy.
We need to pump the brakes. So that can affect conversion. Acute illnesses. So if you're sick, if you have a GI issue, if you have an upper respiratory infection or whatever, your body needs to be focused on slowing down the metabolic processes for a minute so you can recover from that. People in the ICU, when they're intubated, when they've had surgery, when they're having something serious go on.
If you're stressed, your thyroid is stressed.
Yeah, you are not going to convert that T4 into T3 like you should. And that's a good thing. That's our body's protective mechanism in short amounts. Like this is not something we want to go on for long periods of time. So I was going to go back to, so when we aren't converting T4 into active T3, what we are doing is we're converting this T4 into what's called reverse T3. So in those instances, you see people with a higher level of a reverse T3. And from where we like to see a reverse T3 level is like less than 15. I mean, that's safe. But oftentimes we'll see them in the 20s, even up to 30s. And
the best way I kind of explain what reverse T3 is like, obviously we need our active form of T3 for energy. However, if you're putting so much demand on your thyroid that he cannot keep up, the best way I can kind of explain it just for general terms is he's spitting out half pieces of information that does not give you energy. Like he's just like, it's like having an assembly line and you got one man and it's going a million miles an hour. You're going to be missing some pieces. Like he might get something down the belt, but it's not going to be a complete hormone. It's not going to be a complete output. So it does have a purpose. Like it's still being made for a purpose, but it's not going to give you the benefits or that active energy that you're looking for from the T3.
It serves as a protection. Like I said, if you're trying to downregulate that metabolism so you could recover from something, that reverse T3 will go up and it puts the brakes on T3. So it'll stand. So if we're looking at a cell, my hand's a cell, my fingers are the receptors. Reverse T3 will lock on to some of these receptors and kind of block T3 from getting in to say, hey, hang on just a minute. We need to slow some things down for a minute. Okay. And that's truly when you see people like that, especially if it's from an under eating standpoint, when you see someone like that, you have to, well, I guess reverse diet and stuff, but we have to start training that body to use nutrients and stuff a little bit more effectively by refeeding these people. And eventually the reverse T3 will start to drop off and T3 levels will go up. Another way we treat this is with giving T3 therapy. I mean, you can give T3, which is leothyronine, and usually that will bring reverse T3 down and bring T3 levels up. But most often than not, I think really what we use is like an NP, a desiccated thyroid. Yeah. NP or Armor.
Because they're usually a little deficient in both.
Yeah. That has T4 and T3 in it. And we start at a very, very low dose because it's one of those narrow therapeutic index drugs, thyroid is. So you start low and you go very slow. Too much is a bad thing. Too little is a bad thing. So the thyroid, so that's kind of how the thyroid makes hormones, why we're, how we would replace it. But let's talk about we talked about how it affects every organ system. But that book we're reading right now, or that I read that you're currently reading?
Yeah, I'm on it a little bit. We're in the first couple chapters.
It's called Hypothyroidism, the Unsuspected Illness. And it was written in like the 1970s. So it's an older book.
Really good though.
It is. It's still relevant.
It feels it's easily read.
Yeah. It's definitely, anybody could read it. Yeah. So I would encourage you to read that. But he talks about how when the thyroid is underactive, yes, we can look at lab values, but he was a really big advocate for checking what's called a basal body temperature. And a basal body temperature is when you wake up in the morning and before your feet hit the ground, you're taking a temperature, like you're grabbing your thermometer, you're checking your temp. And a normal thyroid patient, a euthyroid patient, your basal body temperature should be between 97.8 and 98.1. Anything less than that indicates some hypothyroid, despite what the labs show. Yeah. And if you ask these people too, hey, do you have constipation? Do you have dry skin? Are you losing your hair? Do you have brittle nails? Do you feel fatigued? You go through this review of systems with them. They're like, yeah, come think of it, I do. Check your basal body temp because on your labs, you look okay. But you might be a good candidate for trying some thyroid therapy for a couple of months. Let's see if it doesn't help you. If it doesn't, fine, we'll come off of it.
And that's exactly what he did. He had patients coming in and it was like, he said he was looking at their labs and they were fine. And then he was like, pretty much their commonality of sentence was, I'm sick and tired of being sick and tired. Like these people were doing the things that they had to do, but they just there was no gusto to their life. They're just like, I go to work, come home, but I'm dead on the inside, low key, like either brain, mentally, physically, whatever. And he was like, well, your labs are okay. And then that's farther on in the book, but she's kind of giving me the spill on it. This is just what I've read so far on my own. So then that's when he had sent them home with the basal body temperature. And he was like, let's just test a theory. So then based off of that temperature, he was like, all right, let's go ahead and put you on some thyroid medication to see what we do. Because technically your levels are fine, but
you're symptomatic.
You're symptomatic. You're sick and tired of being sick and tired. What wouldn't you do to feel better? And these people were like, dang,
this is good.
This is what it is. Yeah.
Yeah. The other thing that they used was a basal metabolic rate. So anybody with a suppressed, so we check an in-body scan too. And most of the time when we see a low basal metabolic rate, it's because someone lacks muscle mass. So we're trying to build that up as well. But he said initially, before they even looked at labs, they were using this basal metabolic test.
Well, it makes sense though. If you don't have enough, if you're not burning, if your internal furnace is not hot, you already gonna, you know what I'm saying?
Right.
Like your temperature, think about it, your temperature and your internal furnace, those are directly related. If you're metabolizing and if your energy is going versus, yeah.
But they found that was kind of a cumbersome test to do. So he was like, there has to be a better way to do this. So that's when they started looking. They were like, okay, we'll look at serum labs. Serum labs say this. Patient's still symptomatic.
Go to the dollar store and get you a
thermometer. Check your thermometer. It's cheap. It's easy. And you can record it.
Look, if my patient came in with temperature readings and was like, here you go, I'd be like, all right, bet, let's go.
And I'm going to tell myself, we use ourselves as guinea pigs. I want to know because I take my health very seriously. So I had symptoms.
So chronic fatigue.
Yeah, I had chronic fatigue. I had some brain fog. I felt better because I've been on testosterone therapy for a long time. I felt better, but I noticed in the afternoon I'm lagging. I have cold hands, cold feet. What was the other symptom I was having? Oh, I would say some slowed gut motility despite being on fiber, and I feel like I eat very regimented, I'm very regimented. But I was having some issues, so I started and I checked my basal body temp. My basal body temp was anywhere from 97.2 to 97.6. So, wait, did I say that right?
I don't know what you're doing.
Yeah, because it's between 97.8 to 98.
I was
Yeah.
like, oh, okay.
Yeah, so I was
don't know what you're
97.2 to
doing.
97.6. So I was like, all right, I'm going to start myself on a little desiccated thyroid. I started myself on 1 grain of desiccated thyroid, and my basal body temp came up to 97.9 within a week. And then the week after that, it came up to 98.1. I felt great. I felt like in the afternoon, I did feel like my brain fog and stuff was improved 100%. So currently, still testing the waters. On average, once you start thyroid therapy, it takes anywhere from 6 to 12 weeks before you're really seeing a benefit. So I tell patients, I'm like, we'll start this. We come back, we check your labs, we check your symptoms. We decide if we want to titrate the dose up or down, and then we go from there. So, and that's called thyroid optimization. Totally, if you're looking at the standard of care, based off of what I guess the Academy of Endocrinology has put into place, you are not overtly hypothyroid until you have a thyroid stimulating hormone, which, by the way, is a poor indicator of thyroid status. Okay. A thyroid stimulating hormone level of 6 to 10, which in my opinion is
You feel like crap. There ain't no way. You walk in there and you feel like crap. If that's your number, you feel like crap. Don't let your doctor fool you. I know you feel like crap. You feel like crap.
Yeah.
That's it.
So it's like you can definitely come back from that, but it's like, why are we letting this happen, Because in the meantime, when your thyroid's underactive, you're building up these things called mucopolysaccharides. Those are like little gunky particles of sugar, and they invade all tissues, our arteries, our skin, our everything. And if you think about it, the sheaths around our nerves, like
you're inflamed.
Yeah. You have this going on in the background. So you have people come in, they're complaining of things like neuralgias. They're complaining of edema. That's where this term mixed edema comes from. I don't know if any hypothyroid patients have ever heard this before.
Edema is swelling, for those that don't know.
And mix is a term that means mucus. So the mucus is causing swelling in these tissues, and it's putting pressure on things like our nerves. So like, again, chronic pain, vision issues. It causes heart problems. I mean, there's so many things, like I said, it's going on in the background. We don't even realize it. So being proactive, identifying these things, treating it is, in my opinion, always better than waiting until there's a problem.
Yes. And I think it goes to show, like, you have you struggle with fatigue. That's what started you down your thyroid journey versus me. You know what I'm saying? I have Hashimoto's. We're going to talk about that later. But we're having two people that's having benefits of it. Okay, yes, I have an autoimmune issue, so I need it. It's not that bad. My antibody's not that bad, but it's changed my quality of life versus her who just had a generalized complaint and she's already started to see benefits of it too. And that's why we like to do what we do and how we treat. You are not a cookie cutter system.
No,
this is not a cookie cutter system. Labs are not cookie. Hey, you know how you got your labs? And I've talked about this before. They go out in the public, they pull blood on people, and people feel just as bad as you do. So
they're not good indicators.
No.
Of what like health should be. Yeah.
You are not a number. Yes, we use guidelines, but right there, two different builds, two different histories, two different life qualities of life. We both benefited from the same drug because we both had a commonality. We were fatigued. We couldn't poop. Her pooping was probably a little better than my pooping, but we still treated it the same way. Like, honestly, like, and I'm just going to go ahead and put that out here. I'm not always 100% on my thyroid medication. That thing gets on my nerves.
It's because you take it twice a day.
I do.
Just take it once.
And you got to take it alone and things like that. But that's what I told her. So, when she said it takes 6 weeks, I want people to be cognizant of that. I think we're in this life of, let me take a pill, fix a problem. I'm going to have an answer that same day. You're delusional. It don't work like that. I'm sorry. But as we continue to take it, and that's what I told her, sometimes you have to actively look at your life and your overall. So I had only been taking a morning pill. And then in the afternoon, I'm still addicted to my caffeine, but it was either a sink or swim if I had my caffeine. Like, I was not going to make it through the rest of my day. We found out my levels were not optimized. We added on an afternoon dose. And then, like, this past week, I'm like, it's helped a lot. Honestly, it's helped with my anxiety. Like, I had my cycle, and I noticed that my binging, my recovery, and everything was a lot better. My afternoon crashes weren't as bad. I've noticed that, like, just my mood's better. I mean, if I'm pooping, I'm not angry.
I know. That makes a big difference right there, you all.
Like,
So,
I don't know. This is off topic, but I just want everybody to know, like, in each episode we ever talk about, we're talking about a lot of information, but as a whole, it is a lot to take on, but your body is an all-enclosed ecosystem. It depends on every part of you to work in order to work well. So when it comes to our thyroid specifically, like, this is home. This is you. So we have to take care of this so that it can communicate to everything else too. And it starts here. Like,
yep. I'm trying to think ways to support the thyroid naturally are going to be making sure you're getting plenty of zinc and iodine in the diet. Like, they've done studies on patients like in, I think it's the Eskimos of, was it Antarctica?
huh?
They're very iodine deficient in their diet. I think it's Antarctica. It might be
Because of what they eat.
Mm-hmm. So a lot of them were found to have hypothyroidism. So I don't know, but obviously there are ways to eat and take care of the thyroid too. That's a
If
whole
you
nother topic.
like the basic things that you can do to aid in your thyroid is eat nutritionally dense food.
A variety.
Yep. Move around, exercise, try to decrease like physical, mental stressors, obviously as much as you can. That's only to a degree, but healthy living, healthy living, sleep, the pillars, go back and listen to our pillars of health. That is simply put, that is the key to everything in your body. You just have to lay the foundation in order for the organ to function. Like, you have to eat, you have to sleep, you have to feed it nutritionally dense foods. You have to make sure that we are taking care of everything. Like, I don't know how else to put that other than just basically what it is.
Yeah. I want to go back to real quick thyroid. I forgot to mention this when you were talking about it's not a one size fits all. I would say thyroid, or what we do in integrative health in general, is definitely an art.
Yes, it is not.
It is an art, and what works for one patient inevitably will not work for another patient. So this is where it comes back down to, we talk about relationship building with our patients. It's like we have to build that trust relationship, that open line of communication, so we can say, okay, is this working or is it not? If it's not, do we need to change something, or do you need to change something?
Yes. And you have to accept that truth too, just like I do.
One thing too, this is a hard subject, but I'm going to tell you, when it comes to the thyroid, alcohol, a drop. I mean, I know we were talking about on the last podcast how we do, we're talking about mint juleps and stuff. But honestly, you guys, alcohol is going to affect your thyroid so incredibly much.
We know this. What is alcohol?
It's a neurotoxin.
It's just a toxin.
Yeah. So we have to think, if we're not getting our thyroid function where it needs to be, and we're tweaking doses, we're doing all things, we have to look at the lifestyle. We've got to address those things as well. So
you can't out supplement a bad life. No matter what it is. That's why people come in the hospital with 500 pounds of medications in bags, because we're treating the problem, but we're not treating the problem.
Yep. So on the next one, we're going to talk about Hashimoto's specifically. And I think that one's going to be pretty loaded too, but I'm excited because I would say most of the time when we find someone who is hypothyroid, there are always Hashimoto antibodies there, which is an immune condition. So we'll dive into that next time, with or without it today.
What do we say?
What we're going to do, first we're going to talk about staycation or vacation.
Yeah, staycation or vacation. Where are you going, bro?
Well, we're going to Destin.
So she's going on a vacation. She answered your question.
I think you do need to break away. But I'm not hating on a staycation either, because I love where I live. And I
think you need me personally, I need a staycation to clean my house.
Yeah.
And then a vacation to get away from it.
Yeah. You need 2 weeks, really. It's like a week to clean, a week to go away. Yeah. And then you come home to a fresh house.
Do you clean your house before you go on vacation? Or do you
Yes.
Yeah.
I can't stand to come home. Ashley and I were talking about this. I hate coming home to a messy house. I even do my laundry before I come home on vacation.
Oh, I got one for you. We're building off that. With or without part 2. Do you hang your clothes when you get on vacation and put them away, or do you keep them in your bag?
I hang them up.
I do
They're not
too.
staying in my bag.
Do you put them in your bag?
You keep them in your bag.
Little
And you just pick
wrinkly.
through it.
Chris,
Golly.
we got to do you better, bro.
I know.
Chris back here with crunchy draws. They all wrinkly.
Chad would do the same thing. Must be a
That's
guy.
okay for you. I like how they can fit it all their life in like one little satchel. They're like, I got 2 pairs of boxers and toothbrush. I'm good. And I'm like, okay, I need 4 heels, 3 outfits. We're going to have a change here on Tuesday.
Yeah. Chad's parents tell the story of him when he was younger. He was going to Florida, I think. And it was like a last minute trip. And so he comes out in a Winn-Dixie bag with his swim trunks and a toothbrush.
I love it. He said, listen, I'm here for a good time, not a long
Chris,
time.
don't act like that.
He's here for a good time, not a long time. Listen, if I go to Mexico, I think I'm taking like 4 bikinis and a sombrero. You lay. I'm going to be good.
I need a sombrero to match each bikini.
There you go. I got one of them big old Beyonce hats. I'm going to take a picture. And it's like
I
4
can't
times
wait.
the sizes of me. I was
You
like,
did get one?
yeah.
Gosh, you're going to have so much fun.
I got to get a good picture.
Yeah.
We'll hide the whole body and it'll just be hat.
Okay. All right. Well, I hope this was insightful too. We'll catch you guys next time talking about Hashimoto's.
Whoa.
Hey, thanks for tuning in. If you enjoyed our content, please comment, like, and share our show. To stay up to date with our practice, please visit our website at www.elevatewellness.com or to subscribe to our YouTube channel, and be sure to follow us on Instagram and Facebook at Elivate Wellness LLC.